Паллиативная помощь по определению Всемирной организации здравоохранения.
Palliative care, as defined by the World Health Organization, is a comprehensive, extensive care to patients suffering from oncological and non-oncological, chronic, progressive, terminal illnesses. The most important here is an adequate relief of pain syndrome and a mandatory psychological, social, and spiritual support to a patient and relatives during a period of illness of a close person and also during the loss. Today, we all should remember the fact that the right of a person to assistance, including palliative care, must be an inherent part of our life. However, not everyone remembers and not everyone knows that a seriously ill, incurable person has the right to a dignified end of life, the right to a decent life at the end of his life's journey. Most often, the more oppressive symptom is a pain. There is a problem that the appointment of narcotic analgesics is strictly metered, that is not exceeding a certain number of medications issued at hand. Unfortunately, quite often, this quantity of drugs is sufficient for the patient just for a couple of days, and there are a lot of bureaucratic obstacles that have to be resolved by relatives of patients before the patient could get his pain relief treatment again. It is clearly stated in Order 173, dated April 7, 2009, about the rules on the approval of drugs essentially for medical purposes, that only 10 ampoules can be issued at hand at a time per one patient. However, there are some cases when, due to the permit and according to the written record of the oncologist, we can issue 20 ampoules, but in very rare cases. Thus, within the framework of the struggle against drug trafficking, there are taken such actions when only a certain quantity of morphine drugs is issued per each patient. So, because of this, and depending on the appointed dose, some patients has to go and see their doctor every other day or every 2 days, and some of them even 2 or 3 times a week. If we now talk about the human right to a dignified withdrawal from life, to the opportunity to find the pain and to access to this pain relief treatment, we must remember that there is an imbalance between the work of law enforcement agencies and the work of the Ministry of Public Health. And only when these two agencies could find a common language among themselves, only then the person will have the full right to a dignified withdrawal from life and to access to pain relief medications. My mother has been sick for a long time already. She is appointed only 10 ampoules at a time, based on 2 injections per day, and at increased pain 3 times a day. First of all, they issue these ampoules not every day, and just on certain days. For instance, on Monday, Wednesday and Friday. And if, for example, you are out of them on Tuesday, do whatever you want. And in fact, there is no other place to get them, since such drugs are issued strictly on certain receipts and in certain places. Can you imagine when, after traveling the whole day around the city, from one end to the other, to find and bring all the documents, and they ping-pong you from room to room, make you climb up and down stairs, sign papers there where there is no doctor in his cabinet, and there are huge queues at clinics, and no one will never let you in out of the turn. Well, to tell a story short, I spent the whole day to get these ampoules. What is most interesting, that when we are out of these ampoules, I'll have to start the whole circle from the beginning, and again to bypass all the same offices and fight. Perhaps it's easier for me to quit the work. Once there was a huge problem. My mother was discharged from hospital before holidays, devoted to the Independence Day, and we came to clinic to get medications. I don't know for what reasons we didn't get them. Either they had no doctor in the clinic that day, I don't know, but we were refused. They told us to come after the holidays, and it's 4 days. 4 days without analgesics. It was awful. She laid up completely during these 4 days, was not able to walk. At a moment, it seemed to her that she was dying. She simply asked for vodka, and I couldn't refuse her. I poured her vodka. She asked for a big cup. She drank it all, and even fell asleep for a couple of hours. And probably she was without pain for some while.
Несколько часов. Ей было, наверное, не так больно.
Сам по себе болевой синдром некупированный ведет за собой
By itself, unblocked pain syndrome leads to the chain of symptoms that disrupt life in general, destroy the harmony, exhausting the patient. The pain is always accompanied by insomnia, loss of appetite, depression, up to suicidal thoughts and attempts. Cessation of pain brings joy not only to the patient, but to all his relatives. And at this moment, they feel as if they solved the problem. And even if the patient realizes that he'll die, the quality of his life should be high. In Kazakhstan, with a large territory and a very low population density in some places, the distance between a particular patient and the office which is allowed to store and issue these drugs could be sometimes pretty decent. Thus, it affects not only the quality, but also the accessibility, even if the drug is available in that medical office. So can you imagine a patient on his 4th stage of the disease with constant pain, who has one of the family members attached to him, who should take care of him, feed, turn him, and so on, and there should be someone else who would go for this drug every day or every 2 days. So this all requires human resources, time resources, and also financial means, since money is spent on the road too. She has been seriously sick for 7 years already. I went on Friday. We've got Friday, Saturday, Sunday and Monday, and we need injection. They gave me only 20 ampoules. I begged to give me 30. No, we can't give you. We've got order, they say. We were out of ampoules already on Sunday evening. When I came back with new ampoules on Monday afternoon, I can't even describe in what terrible state she was when I saw her. It was terrifying. And now, the doctors say that we take too much. But if the pain syndrome isn't so extensive, you wouldn't take much, of course. But now, when she's in constant pain, even after morphine, the pain won't disappear. It becomes muted for a little while. That's it. I got them too much already. And they say I'm not allowed this much, that I've got dependence. But how can I tolerate this pain? They say she's already a drug addict. How could it be? All her life she worked in medicine, And now this medicine makes nothing to help her. They all point to this dependence. But I probably started to use them not because I wanted it, but because I had been prescribed, since the pain got stronger. It is a problem that I live for so long as nobody else. But it's not my fault that I'm still alive. And they accuse me now that I'm not dying. I had to quit job, to stay at home and go for drugs. 25 kilometers back and forth with stops. 500 tenge per day. But I don't work, and I have to borrow money from my acquaintances. What else can I do? She's constantly moaning, crying. I can't simply watch it. I asked them to help me in any way. I'm ready for everything. I'm so tired, and I torture my family. Worldwide, the list of narcotic analgesics is very wide, and there are no restrictions. There are 31 types of analgesics, and we have only 4 of them in Kazakhstan. Those injectable forms that exist, they somehow cause complications during the long-term use. And today, there exist tableted forms of morphine, which could be more available since they are quite cheap and are more convenient to use in various conditions, both at home and in hospital. They can be crushed, dissolved in water, and used as a solution. The decision on the appointment of narcotic analgesics is a liability of primary care physicians. However, the resolution about increase of the dose can only be made upon mutual approval of regional oncologists and primary care physicians. And it's not correct, because the decision to increase the dose is clearly stated among obligations put on the primary care physicians. However, the district internists, due to their poor knowledge of oncology, avoid taking responsibility upon themselves, as they are afraid of making more harm to the patient and have to wait for the district oncologist. Thus, just because of this circle, the patient gets his pain therapy late.
Болел у меня муж, Дедюрин Михаил Иванович. С ноября месяца у него появились сильные боли.
My husband had an oncology problem. He got strong pain since November, and I constantly asked our doctors to appoint narcotic analgesics. However, we received nothing besides ketanol, and of course it didn't help. In December, they told me that they were ran out of everything, because it was the end of the year and the budget would be approved only in March. He didn't even have a chance to live such long until they approved the budget. Therefore, I had to call to the hotline of Aurora Social Fond. After this call, in the evening our district internist brought me 4 boxes of tramadol. This tramadol relieved pain only for 2 hours, and 4 packs are for 10 shots only. He was in a terrible state. He screamed, he moaned. I could hardly watch his sufferings. Nights, he didn't sleep at all. I called for an ambulance 2 times a day, but the ambulance doesn't have even tramadol. Once I left him with our neighbor and went to the clinic to beg for drugs. I told them to give me anything, since I was with him every day. I myself had no rest, neither at night nor during the daytime. He had been screaming all nights, and I asked for analgesics to give him at least during the night time, as the daytime pains we could somehow tolerate. He constantly kept asking, "Give me at least anything." He squeezed his teeth and endured. Our oncologist had never visited us, and when I asked our doctor to give us morphine, she said that the drugs should be prescribed by oncologists, but at first we must drive her to our house in our own car from Talgar so that she could examine him as he was paralyzed, and only then she could make prescription. But it is her job, after all, to visit a patient at least one time for his 6-month period when he got paralyzed. When I myself spoke with our chief doctor, I asked them to put him to hospice just for 1 month, as they do not have any morphine analgesics to give me at this period. How possibly can such an oncological patient wait for pain relievers when it could be a matter of days or maybe of months for him?
В Казахстане, кроме нашего...
Besides our municipal center, there are 5 more hospices in Kazakhstan. I got relaxed. I feel better because I'm not running in search of analgesics. I have nothing to worry about here. There is everything I need, both medications and enough care. As soon as I feel worse, I take a recommendation, undergo necessary tests, and come here. There should be at least 4 or 5 such hospices in Almaty. But the main problem is what to do if the patient is at home, especially if the population, due to religious or other convictions, doesn't want to send their relatives to hospice. So, in this case, we should analyze pain relief adhesive plaster system or develop at-home hospice care, when in every clinic there will be established a rehabilitation team which will travel daily with their own medications, and they will be authorized to issue and take ampoules with morphine. Should any one of the relatives ever encounter this situation, they would hardly get rid of the feeling that they are totally useless. The sensual wound is very heavy. At the moment, she is in a very serious condition. The oncologists refused to treat her already. Originally, she took tramadol, but now it's no longer effective at all. If considered Promedol, it also doesn't have a prolonged effect against pain. In some cases, we need 5 or even 6 ampoules per day. Once I took the maximum quantity of 30 ampoules, and it happened only because I had to write a request that due to the forthcoming Nowruz holidays, on total 5 day offs, I asked to provide her with necessary amount. But in the end, I still had to economize those ampoules. I had to make an injection of diphenhydramine instead of Promedol to reduce pain, or ketanol. However, ketanol is strictly prohibited to her due to her anemia, since it could cause bleeding. But when I see her sufferings from pain, I'll make that injection. Well, in any way, this control and reduction of drug trafficking should not run into idiocy. Where does it lead to? For example, I often think about purchasing drugs from street, just because to save my wife from pain. And if this situation continues, I'll certainly go, since I can't look at her sufferings. Due to the fact that she changed the local polyclinic since Monday, today is Friday, and she's been without Promedol for 5 days already. And on weekend we won't get any Promedol for sure. And even on Monday there is no guarantee I can get it. And what do you think I should do? I will certainly go to street. And what are they thinking about? It seems it hasn't affected them yet. I mean those who invent these laws. I wish they were in my shoes, when you're given an ampoule and you must do your best to extend it. And these doctors who follow the so-called rules and don't see a person behind them, they don't care about the patient, they just try to cover their asses. I want to say that I hate them. Today, I wish them to experience the same what I have experienced, and even better what my wife is experiencing today. Though perhaps It's not good to say like that. It's sinful. But still, I do wish. I took her from hospice on January 23rd, and 2 months passed since that time already. No one ever came to visit her, neither physician nor oncologist, just even to check if their patient is still alive. And who knows, maybe she is dead, and I continue taking the prescription. People should not suffer from pain, having oncology or even other diseases which can cause pain. Anyone must have an access to pain relief treatment. And actually, I would not wish anyone the same what's happening with my wife now.